This is the No Stroke Podcast with your co-hosts David Dancero and Michael Garrow, helping you to support and thrive in life after stroke. Their podcast is designed for educational and community support purposes only and should not replace medical treatment and guidance of your own health professional team.
Wow, welcome back to Season 3, Episode 1. Here we are again, Mike, after a little bit of a holiday break. We're going back in time to a great recording or interview that we did before the holidays. How are you, Mike, first of all? And I love what you're wearing, and thank you very much for the airship gift of the No Stroke merchandise.
That's it.
Beautiful.
Yeah, you're welcome. You're welcome. It was a nice gift that we were able to get out, and maybe one day we'll have merchandise up on the website, but for now it's between us, and we sent a little thank you gift to our good friends up at Tufts as well after the couple of interviews that they had. So if anyone's curious to look at what this merchandise looks like, if anybody's not watching us on YouTube, you could check out our Twitter, and we have a photo of both Caitlin and Lester, who posted a nice tweet of them in their No Stroke podcast gear. So go check that out, and if you like it, send us a message. Maybe we'll get it up for you guys. We'll get some merchandise on the website. But I'm great. It's been a busy couple of weeks. Obviously, the holiday time is nice, a bit stressful, obviously, with this new variant flying around the place. But all my tests came back negative, both me and Megan. So, we were able to get back into Connecticut, see family. It was a bit hectic, but it was nice to kind of settle down, see the family, and yeah, just take some time to rest and kind of take in what a year we've had. But yeah, like you said, this episode, we're going to be going back on a great interview, one that I think really opened a lot of doors to the connection of, brought back a lot of memories. I'm sure for you, David, it was a real cool discussion, just on Marina's cancer journey and how that related into yours, your personal stroke journey, which is cool. But yeah, I know it's been a couple weeks since we've connected, but how's everything on your front?
Very, very good. Thank you, Mike. Yeah, we had, certainly a scaled down holiday, but nice time to reflect and, give thanks for, all the good health that we've been fortunate to experience. And it's hard. We finished our recording of our second season, and we actually pre-recorded some for this, including the one of our guests coming up shortly with Marina. And so it was hard to we were such a fast pace. It was kind of hard to just put the brakes on and slow down and stop for a little bit. But when I was able to do that, I definitely, I've really got a chance to really think about, like we're going to be talking about in the months to come, goal setting around this next, this first, few episodes of season 3. But this is going to be a really, really great episode. I'm excited that we're able to kind of get this one up and live. So we should continue our theme of in the news. I thought, if you don't mind, there was a real important, especially with my background and my story of stroke and PFO and cryptogenic stroke. There was a really good article that appeared in I have to look at my notes. It was this December 13th, I believe, episode of JAMA. And it was important because, December 14th, Journal of the American Medical Association. And it was important because the study pooled data from the 6 big 3 randomized clinical trials that compare PFO closure to medical therapy. And it looked at something called the ROPE score and the newer Pascal score. And these were risk stratifying mechanisms used. The ROPE stands for risk of paradoxical embolism, and Pascal stands for PFO associated stroke causal likelihood. And it was important that this data finally came out, because when if we wind back to when I had my stroke some 14 years ago now, patients didn't have this data to work by to come up with sort of a way to, patients didn't. And then so also clinicians didn't have a way to help counsel patients on what, with the PFO, what might be the best pathway based on clinical evidence. So this coming out really adds to the PFO literature, and it provides that critical evidence that can, immediately influence the clinical evaluation and the care of patients with cryptogenetic stroke. So I shared it with my PFO community over in our Facebook group, and it was surprising that a lot of folks hadn't yet even heard of it yet. So I know there's a lot of work to do in and around the work we're trying to do. I think there's some parallels there with, empowering patients with information, especially with the guests that we've had on in the previous season. So that was impactful for me, and I'll put that in the show notes.
Yeah, thanks, David, for bringing us through that. I think it's just the fact, like, you with your clinical background, you know how to go down, break into an article, digest some of that stuff. I think the hardest thing is, for this patient community and, this, whether you're a survivor or caregiver, is, where to look for trusted information and, how to digest some of that. Because, I think that's, another barrier when we think of barriers, to life after stroke. It's kind of comprehending some of this science that's out there, late breaking things, how to get involved in it. So like you said, that is something that we're trying to do, and hopefully, as we grow and as we, build out what we want to build through the platform, really be able to showcase some of these thoughtful articles and what could really benefit and patients. So yeah, I know it's something passionate to you, so thank you for kind of bringing us through that. And as we approach the new year, I think it's a great tee up for who we are bringing on. As I've kind of sat down on the morning news, you see all these great success stories of weight loss and quick fixes, and everyone kind of looking at the new year as a time to make new goals and have changes come for them. But we know that's, as the stroke community knows, it's a lifelong journey, right? There's no quick fix. And I think with what Marina, who we'll bring on here shortly, has done with YourCoach, has really shown the power of what health coaches could do to support patients in, whether it's what she's seen with life after cancer, or really any challenging event. It's that support, that one-to-one connection, and kind of driving it through. So just to kind of tee up Marina's conversation here. So a bit of background on Marina. I've known her husband, Eugene, who has been in kind of the digital health industry now for years. He's kind of started out in Bayer, worked his way through. So I've been connected in with him through Health Excel. But then recently, about, I think it was 2016, I heard, he made a move and started to look at a company called YourCoach with his wife, Marina. So Marina Borukhovich is the CEO and founder of YourCoach Health, a US-based and Barcelona-based company that is supporting and really trying to advocate and grow this health coaching community. All right, so they've built a platform which invites on coaches to really solve the pain point of dealing with multiple clients, right? So they support billing, they support multiple programs, in-app chat, in-app video messaging, task management, goals setting. So it's a really slick, all-in-one, end-to-end platform for users, or for both coaches and then end users, to make most of their health journey. And it's an exciting time, because what they're also doing is really advocating and putting a staple behind, what health coaching is, and kind of moving it from what was, I forgot the term that she said Eugene used. I didn't write it down when I was listening back to the episode, but it was quite funny. So it's kind of moving away from the holistic medicine into more of a solid clinical framework used in healthcare. So Yeah, they're doing some excellent advocacy work there, which we'll talk about. But one thing that I learned actually offline, which is interesting enough about Marina, is that she started her career as a developer, as a web developer early on with Lockheed Martin, and actually developed the first Easy Pass, which was used. So,
Oh, wow.
yeah. So quite interesting. Didn't really know that, but yeah, there's
Fun
a fun
fact.
fact for us.
Wow. That's
Yeah.
a pretty big fun fact. Wow.
Yeah, I thought that was quite interesting. So yeah, we're honored to have Marina on. As you see in the conversation, she really opened up to us about her journey. And we're thankful for that. I think that's what we're trying to do here, is really be able to show that everyone's human, everyone needs that human connection as well to support them. So it's a perfect tie-in to what she's doing with YourCoach, and what she's been able to do in the last few years since she started the company. But I think it's really exciting for their moonshot plans for 2030, and with the plans that they have in store to really grow this thing. So it was amazing conversation. I don't know, David, you have anything else to add before we jump in?
Oh yeah, I learned so much. I think our guests are just going to really enjoy this. My takeaways to kind of pay attention to are her care delivery comparisons when she mentions care in the U.S. compared to Amsterdam. I think I think their path, and I think the future is very bright for health coaching, as we've been kind of following that model of care, and hope to bring some of those elements into our own platform. And then of course the symposium and the headliner, sex and drugs, like when when she talks about that, and that was a big deal. And with the nutrition background, when she mentions Dean Ornish, who's one of the headliners, he's kind of a guru in the nutrition and preventative medicine space. So I think you really you queued this one up well. So let's get this one started, Mike.
All right, I hope you enjoy season 3, episode 1 with Marina Borukhovich from YourCoach Health.
Welcome, Marina, to the No Stroke podcast. Thanks so much for joining us.
Thank you for having me. It's a pleasure.
Absolutely. So it's a early Tuesday morning for David and I over here, but you are in sunny Barcelona. So thank you very much. It's a different part of the world, but tell us a little bit, how did you get to Barcelona? How did you get involved in this community of coaching, and who is Marina Borukhovich?
All good questions. So I guess I'll start from the beginning. The way to Barcelona has been a long and winding road. I was actually born in Belarus. I was there until I was 12 years old. My parents immigrated to US when I was 12, so I do consider myself an American. And then 10 or 11 years ago, we moved to Amsterdam as expats for 2 years. It was just going to be a nice little 2-year move, and I was taking a sabbatical, and I was just going to enjoy life and just do lunches and work out, kind of like that dream world that you think is going to be something so exciting. So 2 years turned into 5 years in Amsterdam, and then we ended up in Germany for 4 years, most recently in Berlin. And then we've had enough bad weather, and we're kind of debating. So my husband, Eugene, actually, he is my co-founder and YourCoach, which we're going to talk about a little later. But at the time, he was working for a big pharma. He was in a corporate position, and that's why we had to be in Germany. He left to join me, and we no longer were tied to anywhere. We kind of just could be on our own where we wanted to be. And we were debating if we're going to go back to Amsterdam, which we absolutely love, or if we're going to go back to US, where family and friends are. And then our younger daughter, who was she was going to be a junior in high school, she said, "How about Barcelona? We all love it so much. And it's so sunny." And we said, "Okay, let's go to Barcelona." So that's how we ended up here.
Well, that's a nice journey to get there. And you kind of mentioned some of the pieces around your husband Eugene being involved in the digital health industry. I've been fortunate enough to know Eugene for a couple of years now through Jim, and he's also in the space David and I are in this, growing podcast industry. It's Joe, obviously they call themselves, they're teed up next to Joe Rogan, and I know they always have that joke, but we're aiming to get as big as your husband and Jim, maybe one day.
They're having a lot of fun with it. And if that's one thing, I mean, their whole podcast idea was born in the pandemic because they missed being around people so much. They missed connecting with people. For me as an introvert, it was kind of like, okay, great. My family's near me. Everybody's all in one place. I was loving it. For him as an extrovert, it was killing him. He just could not wait to talk to people. And Jim was the same way. And they started this podcast, and it was only going to be through the pandemic. And now it's going, I don't even know what season they're at. It's like season 217 by this point. I don't even know, but they're loving it so much. And the caliber of people that they have on there, just like all these amazing, amazing individuals who have done so much. And, every time, even though Eugene talks about it, and we talk about this all the time, I listen to it with my mouth open every time because of just the wealth of information I get from every one of those episodes. So it's fantastic.
Agreed. And I still, Marina, chuckle at the puppy episode when they had Carlos on. That's still one of my top.
Anything with puppies is always a good idea.
Absolutely.
It's always a good thing.
Well, before we dive in, and we are so excited for this conversation today, Marina, because we see your passion for health coaching and kind of the journey that brought you to this space. And it's something very similar to David and I. We've both been, personally impacted by the results of stroke. And I know for yourselves, we talked a little before we started recording, you have some personal touch to stroke itself, but, you've really been impacted through cancer, and you've seen firsthand what that impacts to your life, to your family, all your loved ones, but how this role of health coaching has really been able to fill those voids. And you and Eugene, the rest of the team at YourCoach, are doing some amazing work, and I'd love to dive into that, and we will, but I have one question first, and it might go back to one other thing that you said. You're a bit of an introvert, and you mentioned that when we're recording here, and those viewers, you don't get the full picture. I hear you're a bit of a fashion nova and you have a shoe addiction. So before we dive into the juice stuff, let's hear, do you have a top, like your favorite designer, favorite pair of shoes? What do we have for the listeners?
This is like telling me to pick my favorite child. This is hard. This is hard. So, I won't even tell you how many pairs of shoes I have. It's a little bit ridiculous, and I fully own it. But right now, my favorite pair has to be a pair of Alexander McQueen boots with studs on them, because they just make me feel really, really badass, every time I put them on. And it's all going to depend. And sometimes, we feel a little down and we just need that like special piece. And for me, it's those boots at the moment. So sometimes it's red bottoms that I put on, sometimes it's Louboutins, and I put them on and I feel like I can conquer the world. So it's going to depend, but I'll pick Alexander McQueen for today.
We have a lot of guests who we've highlighted their superpowers. So we just learned yours. You get those boots on.
I get those boots on. Yeah. It's high heels. It's always high heels.
Perfect.
Because you can, you give you give a girl the right pair of shoes and she can conquer the world.
Love it. Well,
thanks for asking. I love it.
Absolutely. I might have not as many shoes as you, but I'm certainly a bit of a shoe man myself. And I'm still trying to find the organization scheme here. So, maybe we could chat after the show and we could talk like shoe racks or something,
Okay, racks. It's under glass. It's shoe closets with under glass, and climate controlled racks. Michael,
oh boy.
I have a lot to learn. Well, let's let our listeners learn a little bit more about you. So bring us on this journey, right? So you've arrived in Amsterdam, you're living you're kind of at what stage, were you diagnosed with cancer, and kind of bring us to where we are today with founding YourCoach?
So this was 7 years ago. I was 37 years old at the time. We were in Amsterdam for 3 years at that point, I believe. And I was healthy, like I said, I wanted to work out and have lunches, and that's what I was doing. I was working out all the time. I was living a healthy lifestyle. I had a very, very fulfilled life. I had 2 young kids. They were 10 and 12 at the time. Like Eugene's career was prospering. My family was well, like everything was going really, really well in my life. And I woke up in the middle of the night, one night, and I started feeling my breast. It was in my sleep. I don't know. I can't tell you how that happens, and if you don't believe in miracles and the divine, like something like this kind of makes you start believing that there's something bigger out there. I don't know what it is, but there's something. I went back to sleep. In the morning, I was in a shower and I kind of remembered this as a bad dream. So I started kind of like searching again. I was doing like a self-exam, and it took me a while. It took me like maybe 5-10 minutes, which is a long time, but I did find the lump. I went to the doctor that same day, and this is actually a new family doctor. So the way it works in Netherlands, you have to go to a family doctor first, and then they refer you out. So this was a new doctor that has never met me before. And she said, you need to get a mammogram. And I said, I'm 37 years old. Like, is it more harmful? And she's like, I don't think there's anything. I don't think, but just as a precaution, let's do a mammogram. I went to get a mammogram. They did see something. They, again, did not think it was a big deal, sent me for a biopsy. And I think when I was in that biopsy room, and the surgeon who was performing the biopsy, he asked me if I had an appointment with the surgeon lined up. And at that point, I said, should I? And he said, no, talk to the doctor. But at that point I knew, but since nobody thought it was a big deal, nobody came to my appointment with me. I was kind of just doing it on my own. It was just a precaution. It was not a big deal. And I remember walking home and I was crying because I knew something was wrong. Like I just, I felt it. And then we went on holiday. I was diagnosed, this was in June. We went on holiday. We were in Sicily at the time with friends of ours who actually flew from the States. We were in this gorgeous villa. It was supposed to be this like fantastic, 2-week vacation for all of us. And 2 days into it, my doctor called, and it was early in the morning, June 15th. And she said, it's carcinoma. And that was it. My life was changed. It was a long battle. We hightailed it back to Amsterdam, and I thank everything every single day for the doctors that saved my life. My surgeon was the most compassionate man you could ever imagine. He looked at me and he gave me a hug, as doctors outside of US do, because they're not worried about everything else that comes along with it. And I asked him if we can beat it, and he said yes. And he said, I know it hurts, and I know you're so young. And he's like, it's going to be okay. We're going to be okay. And this is actually, Michael, Eugene. And this is the first time I've seen Eugene cry. I have never seen him cry until that point. And he sat there with his head in his hands. And I remember this like it was yesterday, and he was crying. And that was hard. That was hard for me to see. But that also gave me this resolve. And I remember my mom said to me, and she said, you know what, you got to beat this. The kids are little. I cannot take care of them. Eugene can definitely not take care of them. So it's got to be you. You got to beat this. And it was chemo, and it was a mastectomy, and it was several reconstructive surgeries, and it was radiation, and it was years of tamoxifen. And I'm here, and I'm grateful for it every single day. So that's how it started. That was my personal cancer journey. I've also, my dad passed away from pancreatic cancer 4 years ago. My mom, 3 months ago, passed away from gastric cancer. So cancer has played a very, very big part in my family. And what I realized after I came out of it, and everything was supposed to be great, and I was supposed to be at my best, which is normally what, not just with cancer, but with stroke patients as well, right? When you come out of it, it's kind of like, okay, great, you're wonderful, you're rehab, you should be going on with your life. But life is different. Life is completely different than it was before you were diagnosed. And that was a turning point for me. That's when I realized, and this idea of health coaching has always resonated with me. It always sounded interesting, but that's when I started hacking my body back to health, when I realized what it is that I needed. I realized how important it was. And that's when I went on to become a health coach. So that's how my second career got started and brought me to where we are today and having this conversation.
Yeah, that was touching, Marina, and thank you for bringing us down that journey. I could, in the conversations that I've had with Dave, and David and I, you think like we are in the same part of the world, and we're about an hour and a half away from each other now, David, but yeah. We actually met, virtually, and David and I have only met twice actually, which is kind of strange for how much work and how close we are and as friends. But I could only think, as you were talking, how similar David's journey of being a stroke survivor has been, from the age, with the children, to hacking your way through this, with cancer. Obviously, you're going through treatment, you're doing that, and in David's case, his post-stroke, trying to again get himself back and figure out, because if you don't do it for yourself, not many people are going to do it for you, right? And you guys have both gotten yourselves to this amazing place, right? And you have a beautiful family, and you're doing, you have that behind you, but it's gotten you to where you are today, right? And it's amazing to see both you guys, and I'm happy, you're both here, and you're both kind of, taking those lessons learned and building something amazing with that and helping others. So
I'm really happy both of us are here as well. There's a lot to be said about advocating for yourself and knowing what you need. And a lot of times we just give a lot of credit to professionals, right, who are supposed to know what is good for us. And they may know what is good for us when it comes to maybe a medical treatment or the next new cutting edge, something that we can use, right, to get ourselves better, again, in medical terms. But when it comes to holistic well-being, we're the only ones that know what it is that we need and what it is that's going to make us feel better. And it's not always it's not always physical. It's a lot of it is also mental. A lot of it is emotional. That's a huge part of it that a lot of people don't give enough credit to.
Yeah, so true. And Marina, I'm so grateful for you that you are here and you're telling your story. And Mike made a comparison. I could just feel when you bring back and telling your story, and I'm sure you've recounted your experience and your path many times, but I could see that it just comes back to that raw emotion, and you're recounting seeing your husband cry. And then I think, and I've had that same thing happen where, I'll be on stage and I'll be telling my story, and then my sister will come in the back of the room and all those people are meaning to you, and I have to stop and pose, and I get a big lump in my throat, and I'm like, I thought I had this, but I think those emotions, and I think that makes the mission that you're on now with your coach and your team, like, you couldn't have a better leader for your team. So let's dive in. I'd love to know more about maybe the pain points, the barriers to life after the diagnosis that made you know that you needed to do something more.
Yeah, so it was along the same lines of trusting professionals to know what it is that I need. And none of them knew what it was that Marina, at the time, 38-year-old, knew what she needed. I was always active, and, I tell the story all the time, and a lot of times people don't believe it, but I was bald, during chemo, I was in the gym and I was boxing, because at that time, that was literally the only thing that I had control over. I could hit something, I could hit my trainer, I could hit a bag, and I had control over it, like when everything else was spinning out of control. And it's so counterintuitive, because when I told my doctors that that's what I wanted to do, they thought I was crazy. They thought that that it's absolutely the wrong thing for me to do. But they were not me. They didn't know what it is that I was going through. According to them, I should have been laying on a couch under a blanket and just waiting to get better. But that wasn't suiting me. That's not what was working for me, Marina. And boxing may sound crazy to some people, and that's okay. And that's not what's right for them. Maybe for them, it is right to lay on a couch, and there's nothing wrong with that, but it's not a one size fits all solution. When I was going crazy looking for out of season fruits to have in my smoothies, and I was going to every health store in the city, they all thought I was crazy too, because why would you need strawberries when you can have apples? But that's what my body needed at the time, right? So I was importing them from Spain, like while we're living in Amsterdam, right? So it's the things that you know for yourself that you need, and it doesn't matter who tells you what it is. You need to believe in it yourself. The doctor suggested I speak to a therapist, and all the therapist wanted to talk about was cancer. And that is the last thing that I wanted to talk about. I did not want to be called a patient. I did not want to be talking about cancer all the time. It was only a part of my life. And it was so hard for people to understand that, because everybody just assumed that was my life. So these are all the things that led me to the realization that I need to take control. And for me, it was about control. And it was about boxing. It was about putting a wig on my head and putting some fake lashes on and pretending like I was normal. Nobody knew. I can count on one hand the number of people who knew that what I was going through because of that. When I was showing up at my kids' school, I was always put together. And now looking back at it, you do have like a certain cancer face, like when you're going through, there's certain features that change. But at the time, I didn't see any of it. So people saw something was off. I gained a lot of weight for my treatments at the time, but it could have been anything. They didn't know that's what I was going through, because the last thing I wanted for somebody to mention to my kids, are you afraid of your mom dying from cancer? Because that was the last thing I wanted anybody to talk about. So that's how I realized what was necessary. And I actually created this Future of Health Foundation, and it was in Amsterdam. It was a nonprofit, and it was to help women feel in control and beautiful during that time, because something so trivial that we take for granted every day, it's something that makes us who we are. So it started with that. And then once I became a health coach, I realized how many people I can help. And that's, we've talked about YourCoach for a little bit, but maybe let me tell you guys what it is, what the platform is. So it was, I was just going to coach my own clients. I never meant to create this company, right? It was all for me to coach my own clients. And I reached out to my partner, my co-founder, Dan, and I asked him to create this toy for me, this app that I can communicate to my clients through. So we started creating this toy, and now this toy is a platform with over 2,100 coaches who are coaching their own clients, because we realized what was missing. We realized how much people needed to be helped. We realized how amazing the coaches are who are helping people, and how desperate people are to be helped. And that's where the health coaches come in. So we have YourCoach, which is the platform management, practice management solution for health and wellness coaches, where they bring their own clients onto the platform, and it's truly an end-to-end solution. I know that word gets overused a lot, this end-to-end solution, but that's what it is. Anything from onboarding clients to setting goals and tracking tasks. They can have video calls and chats right within the platform, share materials. So you don't need to leave. It's truly a coach's virtual home. And in creating that, we realized all the niche specialties that the coaches practicing on the platform have. So like I said, there's only over 2,100 coaches right now, and each one of them does something absolutely different. So what we started doing is those coaches that are practicing on the platform, we match them with clients, members, or talent of companies who are looking for health coaches. So the more they practice on our platform, we get to know more about what they do, what kind of people they can actually help, and we match them with actual clients. So these are not cold calls that they need to sell to. These are actual clients who want to be helped. And I think that's truly the power of our platform.
Very cool. And maybe, we spoke about kind of briefly the health coach role, right? And I think there's still what you're doing for health coaching is defining it, and you're bringing it into you're bringing it from what was kind of your natural remedy type, it kind of fell in that holistic wellness type bucket, and you're bringing it into a real healthcare setting. And it's certainly making that move when you look at some of the primary care settings here in the States. Iora Health have built these primary care models around health coaches. It's used in some of the digital health startups. But can you just define for the listeners the role of a health coach? And again, like you said, they're all a little different, but kind of if you had to define the role of a health coach, let's hear it from you.
So in a really simple terms, a health coach is a supportive guide or a mentor who helps people get to their health and wellness goals using science-backed behavior modification techniques. So, Eugene likes to use the word voodoo science a lot, because back in the day, like, a lot of people thought that's what it is. True health coaches, it really is science-backed. I mean, these techniques have been researched, they've been proven very effective, and health coaches truly are making a difference. And just last year, they were recognized as an essential part of a healthcare team, which is tremendous.
Yeah, in fact, here in the US, one of the larger carriers, I think, is it Cerner or Cigna, announced that they were reimbursing. Is that?
So health coaching is still not reimbursable. The VA is testing Category 3 CPT codes right now. Okay. So it's not truly reimbursable yet. We're hoping that within a couple of years. And we are on the platform, that's what we're doing as well. Like, we're tracking to help. We're tracking these codes, so when they do become effective, we're there already.
Perfect. Can you talk a bit more, Marina, about, I love your model. I love the platform. I love the deep linking to connecting tools. And I also really like I think the way you put it in one of your presentations was every coach needs a coach. Yes. Can you talk a little bit about the mentorship component to the platform?
Yeah, I mean, I think it's so important. And as people, I think we need mentors. As coaches, we need mentors. So mentors are other coaches on a platform who help coaches who are maybe just starting out, or who are perhaps in a little bit of a funk and they just need some help getting out of it, right? And these are mentors that help coaches either with their coaching practice, with their business practice. So there's a few different things. We also just launched, and this is super exciting, we just launched an apprenticeship program with Dr. Sears Wellness, who are a fantastic health coaching school in the US. And so for the coaches just starting out, we provide them with a mentor coach, and also with a client who understands that they're working with an apprentice coach. And this mentor sits in on one of the live sessions. They also able to review notes with the apprentice coach after the session. And this way we help those who are just starting out, we help them as well. Because, it's great to create a platform for coaches who have their own business. And I love that. I love that aspect of it. But we also want to help those who just graduated and who are maybe not really sure what their next steps are. So that's where the mentorship and the apprenticeship come in.
Perfect. Thank you.
Yeah. And we believe in a community, and community aspect of coaching is a huge factor of what we do. We actually have a community manager that is part of the YourCoach team, and she works with coaches on a platform all the time. And this is not customer support. This is truly to support them and what they do, what they do best, which is coaching and working with clients. And we want them to celebrate themselves, because so many times it's so hard to celebrate your wins, right? Because everybody is always there. There's a saying, right, that you find your true friends when something is bad, or, true friends come through when you truly need them, right? But I truly believe that you can see true friendship. It's in people who actually can celebrate you when things are going truly well. And sometimes that's the hardest thing to do, because you always reflect on yourself, right? Because it's always like, oh, it's going well for them, but what about me? But it's not about you. It's truly about that person. And this is what we're trying to grow in our community as well. It's about celebrating each other. It's about celebrating our wins. It's about that camaraderie.
So well said. And I'm reflecting back to, with my own journey, and some of my thought were my close friends turned and ran when it maybe a feel of being awkward, but the community you're building is, I mean, I can sense it, and the interactions on your social, and from watching some of your presentations, of which you do it's hard to bring that across in a podcast, but I think in the show notes would definitely put one of your last walkthroughs of your platform, because that was so well done. So we're definitely going to get that link from you for the after show.
I think I'm truly passionate about what I do. And I think when somebody is passionate about what they do and what they bring out there into the world, I think it shows. And, I laugh because I used to prep, quote unquote prep before I came onto stage every time, or before I did one of these presentations. And then Eugene looked at me one day and like I was crazy, and he's like, you know what you're doing, this, you live this, you talk about this all the time. And something just clicked. I'm like, absolutely, this, if I know anything in the world, like this is what I know. So no more prep for me. That's it. I just go out there and I just do me. And it's Marina, it's raw, and it's unedited, and it's not everyone's piece of cake, but those who know appreciate.
Well, you're perfect for our show, because Mike has to keep me on task a lot. So Mike, go ahead, Mike, before I go.
No, now that we touched a little bit on, presentation and delivery, and how you guys are, really creating this niche within the industry and growing it out. So let's dive into your symposium. So you had your first one last year, correct? And so this is your second ever symposium, and like the names and the companies that you're getting involved in this are just remarkable. So talk us through that, and what were some of the events this year and topics discussed?
Yeah. So last year, I mean, just like Eugene's podcast, last year's symposium was also born in the pandemic. And it started out, I kid you not, it was going to be a webinar that we were going to put together, just a webinar to just share some health coaching news. So that turned into a 1.5-day event. And we're very lucky. We had Dean Ornish do the keynote last year, which was a fantastic conversation. And I was a little starstruck, talking to him. And we had amazing panels last year.
Marina, can you just explain for the listeners who that was? The first guest that you mentioned?
Dr. Dean Ornish.
Okay.
Yeah, he does amazing work with Alzheimer's and all about reversing disease with lifestyle medicine.
Interesting. Okay.
Yeah. So absolutely amazing. You should look up the Ornish Foundation for the listeners out there. So we had an amazing conversation with him and his wife, Anne, and that was fantastic. And then we had panels we had an international panel with health coaching organizations worldwide. We had inclusivity panels, diversity panels. And then this year we said, we did a 1.5 days last year. We need to do 3 days this year, of course. So this, we're not an event company, right? Like we are a platform for health and wellness coaches. But we put on this event, and the first day we had a keynote with Dan Ariely, who is a behavioral economist and just brilliant, absolutely brilliant, and so well known. And the coaches were so excited, and all the attendees. It wasn't only attendees; we had over 1,000 attendees. About 20% of them were coaches, but there were a lot of other industry leaders. We had Saren Rothberg the next day, who is a stage 4 cancer survivor. And she has the Comedy Cures Foundation. That was the keynote for the next day. We had Dr. Gautam Gulati as a keynote for the third day. I mean, some amazing, amazing names. We had panels, anything from ROI on health and wellness coaching. We had a panel with Leanne Webster from National Board for Health and Wellness Coaches. We had a mindfulness panel. So just a lot of things that we wanted to bring value to coaches. So for anybody who was listening, who was tuning in, we wanted them to walk away not with just, okay, here's another thing that I attended. We wanted them to actually walk away with knowledge that they can apply to using in their everyday lives, whether it be a coach or a client or like really anybody.
Yeah, I love that. And I missed this year's event, but I followed along on Twitter. Last year's event, though, was amazing to kind of see this all come together. I was still working in the health coach industry with the company over in Ireland at the time, and it was hard. I was trying to sell what the impact of health coaching could do, and it was gaining some momentum. But to be in that room and hear from those experts, like you said, and it was great to see, and it's only gotten so much better over the last year. So congrats for that. I did see one panel that is a little juicy, and it's something on our podcast we like to kind of break out of the I think the way you say it is making the unmentionables mainstream, right?
I know exactly what you were talking about.
I was wondering, Mike, when you would go there. Go ahead.
Let's chat about it. What was discussed in those sessions, and any kind of interesting tidbits that we could take away from that?
Sure. So you're referring to the sex and drugs panel?
I am.
Okay.
Yeah.
Sex and drugs panel, because why not? Because we never shy away from important topics. I don't want to talk about, if everybody's talking about it and everybody understands it, that means we're too late. So I want to talk about things that people are shy about, that people shy away from, that people are curious about. So sex and drugs and coaching. There's cannabis coaches, and it's been a very popular topic as cannabis is becoming more legalized within US and across the world, really. There's a lot of coaching around sexual wellness for women and men, and that's not really talked about that much. So we wanted to bring attention to that. And it was truly a fantastic panel. We got so much feedback about it because people tuned in just for the name, but they stayed because of how interesting it was. And we had Jess DeMassa hosting it, and Jess yells sex and drugs. We say more at the beginning and people are just engaged, right? Like they're tuned in. So we talked about different tools that coaches can use in working with clients, right? Because people ebb and flow, and wellness comes in all different forms and shapes, and sexual wellness is part of it. So we want to talk about it, and we want it to be a topic that people are saying, can you believe they did that? Yes, we can believe, because everybody should be talking about it. So that's just something about what it's like here at YourCoach.
Well, it must be a fun place. I mean, you're in sunny Barcelona, you're working with your husband, which has to be an interesting day to day. But no, it's amazing work. And it is cool that, you're going down these, taboo, for what people think is often, something not to be discussed. And that's what we hope to do for the stroke community as well.
I think there's so much value in that, and there's so much value in educating people, and it's educating the mainstream public. And a lot of what we've been doing is demystifying health coaching. And that's why I think there's so much value in the symposium that we did, because a lot of people tuned in who are not really sure about what health coaching is. And if you don't mind, I just wanted to talk a minute about what health coach. There's a lot of these digital health companies out there, and everybody's interested in using health coaches these days. But the word health coach is so misused oftentimes. Health coaches are not nudgers who are going to get people to use your app. Health coaches are not there to tell you what to do. Health coaches are there to truly bring out the best in you, to truly understand what it is that the person needs in their health and wellness journey. So we've been doing a whole series on demystifying health coaching, and that has been actually received so well across the board. And I think that's what's missing, the educational piece of it. So it's great that, we always say that we're spearheading this health coaching revolution, and we want people to join us on it, because even though health coaching as an industry has been around for over 20 years, just now it's getting the voice that it deserves. and I'm here for it. Like, I'm so excited for it.
Yeah. Well, can you, is that through your platform? Because that's a really important educational piece. Is that how are you getting that out there? I think a lot of folks could benefit from that.
Yeah, so we have a series of blogs, and they're up on our website, and people can go and they can read about it. I do a lot of talks. I'm demystifying health coaching. I talk to a lot of companies about it as well. So companies that want to bring health and wellness coaching to their talent, and that's what we're doing. So we started with small and medium-sized businesses who wanted to bring health coaching to their talent. And we match that talent with health coaches on our platform. And it's never one of those, I want a coach, I have a coach kind of match. It's always based on so much deeper. We have a health concierge that goes into like an intake to understand what it is that the person needs. And we match them with a health coach that has worked with somebody like them in the past and can get them to that point. So we started with small and medium-sized businesses, but we're going to companies who want this for their clients and members as well. So that's always been our mission by year 2030 to bring health coaching to the projected 9 billion people in the world.
I know you're going to get there. I have a quick follow-up question, because for what you just described, and there is this shift in this, and I think the pandemic definitely put a microscope under it more. We have, in my profession, in physical therapy as well as occupational therapy, and there are a lot of professionals that are looking to make the switch because they're tired of treating in the episode of care, and they want to bring in a more holistic view of the patient. We treat the knee, for example, in PT as if it's its own little micro. Like, if we don't factor in the fact that maybe you're carrying 75 extra pounds and your diet is not supporting or is pro-inflammatory, but we don't, our model does not allow us to actually even talk about that. And I have a background in nutrition, so I feel completely comfortable doing that. But for the folks that may be looking, they may be a degree professional, but they're looking to maybe transition out of the traditional care models and move more to wellness and more of a holistic coaching. Are you finding, are there professionals that are coming into your platform that are looking for counseling or mentorship?
Professionals who are looking for coaching mentorship?
Yeah, that maybe maybe have been in the maybe in physical therapy, again, use that example, that are looking to get guidance on how do I get the training and more skill to be able to complement the work I do, but to bring it into another more of a wellness focused transition, where maybe they feel like they don't, or maybe they don't know of the resources to hand that person off comfortably to someone when that episode of care ends, and they know they still need more help.
Got it. So we're not really an educational platform, right? So we do have resources, we're really big on educating the community, and we have blogs that we put out there and resources, but we are a health coaching platform at the end of the day, right? So we do events as supplement to what is truly our business, right? Which is the health coaching platform. So what I will say is that there are a lot of health coaches on a platform who are starting their second careers. So these are physical therapists who are going into health coaching. These are nurses who are going into health coaching. And these are nurses who are so frustrated with the system. I mean, talk about nudgers. They've been doing administrative work. Nurses are not allowed really to be nurses anymore in US because of budget cuts. There's so much that they make the nurses do that is truly not, I spoke to somebody who said, what I've been doing for the past 2 weeks is changing bedpans and writing up, writing notes. And she's like, I can't even interact with patients anymore. This is not where my training is. This is not where my value is. So people are just frustrated and they're leaving, and they're coming onto the platform for their second careers. I mean, I did read an interesting study recently about how there was a nurse-led health coaching study in China to improve hospital to home transition for stroke survivors. I don't know if you guys saw that, but that was fantastic. So that's what I think the power is, right? It's in having all these different experiences and encompassing them and combining them together to truly create that one-of-a-kind experience for that person who truly needs it. So I hope that answers your question. If somebody comes to us and somebody contacts us, we're happy to provide resources, but we're not, like a place where you go and you just type something in and it just pops right up for you.
Got it. And the nursing example is a perfect one, especially now. And I'm married to one, so I totally get where that has been going and is presently. And I know we've had nurse stroke navigators on our show, and the care coordination is a pivotal. They often say that the next step after you get discharged is even more vital to your recovery. And that's where in stroke, especially, folks get lost. It might be for reimbursement reasons, but it's not knowing the next handoff or the next ability to connect that person, or the barriers to connecting at the right time, which can, make or break. The dreaded word that we don't like to use is plateau, but I'll just say it. It can get someone over that plateau and care outcomes that connecting care in your platform as you grow. I think you're only going to see more and more, like you mentioned, Marina, second career.
Yeah.
For those reasons of burnout and feeling like you can't fully help the patient or bring them over that bridge to wellness.
Yeah. I mean, it's interesting you say that, because that's what we talk about health coaching. Health coaches are there for what goes on outside the doctor's office. And I think that's where therapists come in. That's where nurses come in. I mean, fun fact, had no idea that there's no CPT for nurse reimbursement. Nurses are not reimbursed by insurance, which is mind-blowing to me, and talk about the whole US care system. Can we talk about that for a second, about how broken that is? I was going through my treatment in Amsterdam. Literally, I mean, not one penny out of pocket for anything that needed to be done. There was somebody coming to my house to give me shots in between sessions for me to feel better. There was, if something wasn't covered by insurance, there was a grant for it. Most recently, like I just mentioned, I lost my mom to cancer, and she was in hospice care for the past 3 months. She was in home hospice, and, nurses were coming to the house all the time. But the first time when they came in and we were talking about the care for my mom, they wouldn't even talk to us. The guy was on the phone, the nurse that came in, he was on the phone with the insurance company for 2 hours trying to figure out her coverage. My mom had the best insurance. She was completely covered, everything was, but they were sitting in our house with my mom, who was dying of cancer, with me, who was sitting there so frustrated and advocating for her. And, we are very, very sarcastic people. So I turned to my mom, I'm like, is this really how you want to be spending the last months of your life? And we both laughed about it, because that was literally the only thing that you could do. It's a frustrating system. So I'm hoping that with these reimbursements that are coming for health coaching, because now health coaches get half an hour with the patients, with the clients, they get 45 minutes. It's not these 8, 10, 15-minute increments that the doctors get and that they have to get paid for. And sometimes not even enough. They get pennies on a dollar, right? So until this system changes, it's just really frustrating to watch.
And I think, did you say at the beginning of this, you were proud to be an American, or you're just from America?
I am, I'm still very proud to be an American. My parents went through a lot to get us there, so still very proud. But as a proud American, I want to change the system.
And you're doing that. So
I'm hoping, it's small steps, and it's not just one person. It's all of us. And I always say this, there's power in our voices. There's power in sharing our stories, and we should talk about it more, because we always think, what's my one voice going to change? But 1 + 1 + 1, now there's going to be an army of us, right? So we just need to keep talking about it.
All right. Well, we always end the show with a special question to us, and we're going to reframe it a little bit, because as you said, you might not, normally all of our guests are very kind of in this world of stroke, but you have some experience, and I think just your lived experience is by far capable for you to answer this question. And I might also change it up a little bit. So we normally ask, if we were to hand you a magic wand, you know, how would you redesign life after stroke? And we'll maybe change two things. The magic wand will give you your pair of Alexander McQueen shoes, and
Love it. They're magic.
And we'll then say just this life after experience. So we're put on your favorite pair of shoes, and let's hear how you conquer this space.
The life after experience. So I love magic, you know, so yes, let's take that. So let's stop calling people patients and just treating them like their disease. We're people. It's just part of it. It's just part of what we're going through in our very complicated day-to-day lives. So with my magic wand, I want us all to be treated like people and not the disease that we're going through. And then life after, design life after to be what it is that we want it to be. Just no barriers, just no barriers. And I think, you know, I do think health coaching is a big part of it. I do think working together with a team, you know, I think it's the doctors, and I think it's therapists, and I think it's coaches, and it's everybody coming together to create this power team of what it is that the person who just went through this life-changing experience needs. And it's all accessible. That's my my pair of shoes. That's
perfect.
I'm going to add a little tidbit in it, and I'll say that everyone is on a beach in sunny Barcelona as well.
Perfect.
So, right?
I love it. I love it. Having a, what is the region? Having a mojito? I don't know.
Hey, yeah, whatever.
I'm so glad, Mike, you didn't ask with the magic wand to solve the broken U.S. healthcare fragmented system, because, you know, I'm glad you gave her Marina an alternate option. But I'm just gonna say this has been a phenomenal kickoff to our season 3. I don't know if we mentioned that at the start of the show, and everything you're doing is so needed now. So continue on that mission, and I could tell from you sharing your story that it's in there and you're going to get it done. And in any way we can help, we're going to share all the show notes and put up as much information as you'd like to. And we're going to keep following the great work you're doing, and hopefully we can work together to continue to get this connector that is so needed in health coaching, crossing that bridge, as we brought up in the show about the bridge from healthcare, broken as it may be, into the transition to getting back to that person, not that patient, but that person you described so well.
That person, healthcare to well care.
Yes.
I love it. And I think Marina will be a great keynote speaker for us, David, at the Enable Us symposium that will happen.
It's gonna happen.
We're coaching.
Yes.
Marina and Eugene didn't think they were gonna have their symposium, but
you guys, you don't know what you're getting into. You don't know. Abort.
we might need another, maybe 2 or 3 actual physical get-togethers between I'm joking here, but you've become my digital much younger brother. Can I use that term?
Thanks.
Over these last, so we've
not much. Come on, don't
a little bit. Well, especially early in the morning, you know.
Oh, I love this.
This has been great, and Mike, let's make me wrap it up, because I could go on. I have other questions, but maybe there'll be a part 2, or maybe we'll bring Marina into the first Enable Us Summit as a headliner. So
yeah, we will see. But yeah, it's been a pleasure, Marina. Thank you so much for your time, and best of luck. We'll certainly be following and giving you all the encouragement we could do. So thank you again.
Thank you both so much. It's been such a pleasure.
Have a good day. Bye-bye.